My name is Dr. Walker. I am an opioid addiction specialist at suboxoneclinics.com. Suboxone Clinics is one of the biggest opioid addiction clinics in the United States. Let's talk about opioid addiction among veterans. Opioid addiction among veterans is a serious and complex issue that has garnered significant attention over the years. Veterans, especially those who have been deployed to combat zones, are at an increased risk of opioid addiction due to various factors such as chronic pain, mental health issues, and the availability of prescription opioids for pain management. Here are some key points to consider. Pain management. Veterans often experience physical injuries and chronic pain resulting from their military service, which can lead to the prescription of opioid medications for pain relief. Prolonged use of opioids can increase the risk of addiction. Mental health. Many veterans also face mental health challenges like post-traumatic stress disorder, PTSD, depression and anxiety. Opioids might be prescribed to manage these conditions as well, contributing to the risk of addiction. Accessibility. The availability of opioids within the healthcare system can make it easier for veterans to obtain these medications, potentially leading to misuse and addiction. Transition to civilian life. The transition from military to civilian life can be challenging, and veterans may struggle with feelings of isolation, lack of purpose, and other stressors that increase the vulnerability to addiction. Overprescribing. There have been cases of overprescribing of opioids within the Veterans Affairs (VA) healthcare system, which has contributed to the opioid epidemic among veterans. Polypharmacy. Veterans may be prescribed multiple medications to manage various health issues, which increases the risk of drug interactions and unintentional misuse. Treatment barriers. Stigma around addiction and mental health issues might deter veterans from seeking help. Additionally, there can be challenges in accessing addiction treatment services, especially in rural areas. Collaborative efforts. The VA and various organizations have implemented programs to address opioid addiction among veterans. These programs focus on pain management alternatives, increased access to mental health services, and raising awareness about the risks of opioids. Research and education. Researchers and healthcare providers are working to better understand the factors contributing to opioid addiction among veterans and to develop targeted interventions. Education and training for healthcare providers are also important to ensure responsible prescribing practices. Holistic approaches. Treating veterans' physical and mental health needs in a holistic manner can help mitigate the risk of opioid addiction. This includes utilizing non-opioid pain management options and integrating mental health services. Addressing opioid addiction among veterans requires a multifaceted approach that involves medical, psychological, and social interventions. It's crucial to provide adequate support, resources, and education to veterans and healthcare providers to effectively combat this issue and improve the overall well-being of those who have served in the military. For updates on opioid addiction recovery topics, please subscribe to our channel. To make an appointment, please schedule on suboxoneclinics.com.